The tonsils, if you're going to ask them, are going to be on the half of the head. Okay? So you have, there are these things. They're sort of lumpy. There's one here and there's one here. The palatine tonsil is right here because it's right at the back of the hard what? Palate. See where the uvula comes over? And then right in here, and I'm going to clean, it's sort of a lumpy thing here, right here. That's a palatine what? Tonsil. The pharyngeal tonsils are up higher. They are right here. I can't see the number, I'm upside down. But this would be your pharyngeal tonsil. This would be your what? Palatine tonsil. And I think if you just remember that this is the palate, right? Palatine is by the palate. The pharyngeals are what people call their adenoids. They're up a little bit what? Higher. Then you have the opening of the auditory tube. And a student here did a really nice thing for you. I will clean it. But see how they made this? They took a pencil and they darkened it up so lovely? That is the opening for the eustachian what? Tube. They have, I think it's 426 with an arrow pointing what? Down. Now, the pharynx, it's pretty, it's general. I would ask you for the area. All you want to keep in mind is that if this is the nose, then the nasopharynx is behind the nose, right? Oropharynx would be behind the tongue, right? If I'm down here, this would be laryngopharynx. Nasal septum. It goes down the middle of the what? Nose. The nasal, what are called the conchi. If anybody remembers those from 135, they're bones. They're these protrusions here. 425, 424, 422. They're the bulges. There is a superior, a middle, and an inferior. I'm only asking you to know them as the conchi. The meatuses are the grooves underneath. So that you have a groove, then you have a bump. You have a groove and a bump. So the indentations would be the meatuses, and the protrusions would be the conchi. Olfactory region is at the very top of the nasal cavity. So it would be up here. May I see that one? The other one? Yeah. I would probably use this one because if you look at it, see where they have the little white lines up there? See them up here? They're indicating those are olfactory what? Receptors. And again, these would be the conchi, these would be the what? Meatuses. If you get the external nears wrong, I have no pity for you. They're the holes I'm about. They're the holes. Before you leave, those of you who stayed only for this, I do have one more respiratory bottle I want to show you, so when I'm done, just let me, I'll go get it. Okay, now, the larynx. Lovely larynx model. So what's this whole thing that's a larynx? Thyroid cartilage is the big one on top. All of this is thyroid what? Cartilage. Okay. Cricoid cartilage is this one on the what? Bottom. But watch, on the back, the cricoid cartilage comes all the way what? Up. So if I tag it on the back, this is cricoid. Where it confuses people is that there's no thyroid cartilage in the back. This one comes up in the back. Okay, epiglottis. It's right there. This is the epiglottis. Do not remove it. This is your hyoid bone, like a horseshoe. Then you have the little cartilages, the arytenoids and the cornicunates. They're on the back. The bigger ones here are the arytenoids. There's two of them. They're triangular. If you look very close, at the very top, these two little ones at the top are the cornicunates. They're at the top. There's a line between them. Okay. So these are the arytenoids here. These are the cornicunates. And then you have the vocal cords. The vocal cords are these sort of like a peach color inside. You see them? And then the trachea goes down here. Now, I could ask some of this on here also. Not as much. This has the best detail.
Is that a hint?
But I've sometimes done a little bit of both. In other words, is this the larynx right here? Yeah. And this piece that's sticking up here, this would be the epiglottis. I would say in the front, this is the what? Thyroid cartilage. This is the what? Cricoid. These things right in here, these like this little pink area, this would be vocal what? Cords. But I couldn't ask a whole lot beyond that. I could get a lot more from this. I will find the trachea model to show you, but I can't seem to find it right now. But the trachea model, I can show you on here when I'm done. I will bring that model to class on Tuesday, or if someone finds it later, I'll be around a good part of the afternoon. Okay. Diaphragm, I would need the torso. I'll get the torso in a minute. Okay, if you talk about the lungs, where are the lungs? Right here. Oh, I could ask, and you could get the diaphragm on here. Can I just move this over so it's not in anybody's way? It's so tall. Okay, this would be your what? Diaphragm. These right here would be the what? The lungs. Now, if you look at this, on the right side, in humans, you have 3 lobes. It's very different than the cat. The superior lobe is on top, then you have the middle lobe, and then you have the what? Inferior lobe. The left side only has 2 lobes. Now, you have these fissures. They divide the lobes. The horizontal fissure goes across right here. You will have a horizontal fissure on the right side. Then down here, this one here is the oblique, and the left side only has an oblique. Oblique is at an angle, horizontal's across. Superior, middle, inferior. Left one is superior and what? Inferior. Also on the lung, you have the cardiac notch. It's on the left lung. See it right there? What's the cardiac notch going to do? That's where the heart's going to what? Sit. The hilus. Very, very hard to ask on the lab test. Everybody paying attention? Very hard. Okay. The hilus on the lung is an indentation right in here. The chances that I will ask it on the lab test are very slim. Probably ask for a lecture test. What's the apex of the lung?
What's the hilus?
It's right here where the things go in.
Okay.
It's like a notch on the inside. Okay. I've used the word apex when we talked about the heart. Remember, the apex was always that part that was like a cone. So where do you think the apex of the lung is?
At the base?
No, it's at the top. This is the apex.
Oh, yeah, it's a base.
This is the base. This is the what? Apex. I don't have the base on here, but see through the word out there, I'll say the base of the lung rests on the diaphragm. The apex is up on what? Top. It's almost a reverse of the heart. Isn't the apex on the bottom of the heart? Yeah. Costal surface. You have to watch this question if I ask it. I would put a series of dots and I would say, what's this area? The costal surface on the lungs on either side is where your rib cage would sit. You understand that if this was in the body, the rib cage would be sitting here? So you have to really watch the questions on the lungs. Is it a fissure? Is it a lobe? Is it a surface? Is it an indentation? Because the answer is going to be keyed on the question. That means you've got to relax when you're taking it and really read the what?
Question.
The question. Okay? 2 things I want to show you on respiratory. If you'll